Thank you, Hindi team. And now it is a time for our English webinar. Today is our 1919th day of continuous webinar. Welcome all the participants for today's session. As usual, we'll begin with a prayer. Welcome, everyone. Today is our 1919th day of continuous webinar. Today's our speaker is Dr. ROHIT Srivatsan. He's MD in Homeopathy and running Victory Homeo Clinic in Bangalore. And he's MD in practice of medicine and presented papers on fibroadenoma, gallstone, speaker in many seminars and presented many papers regarding the treatment of ADHD, autism, bedwetting, about the nutrition, how to nurture the children. So he's the speaker of many sessions, and we are glad to invite you, Dr. Rahul, for today's webinar. Doctor, you're welcome. Please.
Hello. Namaste.
Dr. ROHIT Srivatsan.
Yeah, good evening, ma'am. I would like to thank IFPH for giving me another opportunity to present my paper on rheumatoid arthritis. I'll just share my presentation first. Yeah, so I'm Dr. Rohit Srivatsan. I'm practicing here in Bangalore. I'm a third generation homeopathic doctor. So I've been practicing since the last 14 years now in Bangalore at Malleshwaram and Hebbal. So today's topic would be on rheumatoid arthritis treatment through homeopathy. So I'll start my presentation now. So rheumatoid arthritis, is a chronic systemic autoimmune. So we all know about rheumatoid arthritis. It belongs to the category of the autoimmune diseases. So very important thing of rheumatoid arthritis is it is symmetrical, which is very important that whichever joint on one part of the side of the body, the other side also the same joint gets involved. So this is something which is very important and becomes a very important differential diagnosis in depending on the other types of arthritis. So this is a slow chronic condition and it involves multiple joints and majorly smaller joints of the body. So again, this becomes a very characteristic factor of rheumatoid arthritis when we compare it with the other arthritis in the body. So arthritis being joint pain. So rheumatoid arthritis is nothing but a chronic systemic autoimmune disease. So here what happens because of the inflammatory changes in the synovial joints. So synovial joints are the joints which have movements, free movements. So there is a fluid inside, basically these synovial fluids, which help to absorb shock and free movement of the joints. In rheumatoid arthritis, there will be destruction, erosions, and if not treated well or if not taken care well, can lead to joint deformities. We'll learn more about rheumatoid arthritis in the further slides. So common three important things in rheumatoid arthritis is pain, swelling, stiffness. And women are majorly basically risk factors we would see in women being more than in males. So just a small highlight on anatomy. So because whenever this is a topic of it's a clinical topic, so it's important for us to know which of the joints are involved majorly. As I told you, smaller joints, so majorly hand and toes are the first initial joints which get involved. Maybe later on the elbow and knee joints can also show inflammations and degenerative changes. Unlike an osteoporotic where the large weight-bearing joints are involved. So here, so we should know, I've already told you synovial joints are involved. So there are synovial fluids, and then we all know the joints, that is distal interphalangeal joints, proximal and metacarpophalangeal joints. So these are the type of joints which are there. Why am I informing or stating these things? These are the specific sphere of action of the disease where you would see the changes happening, pain happening, deformities happening. So this is something which is very important, that we know what is normal. So going forward, the pathology of rheumatoid arthritis. Now, pathology of rheumatoid arthritis, there will be pannus formation. So here, synovial membrane transforms from a thin layer. So synovial fluid membrane is a very thin layer. In rheumatoid arthritis, there will be hyperplasia. So thickening is there, vascularity is more, inflammation is seen, and there will be pannus formation. Now, this is a very important symptom, pathology of rheumatoid arthritis. And very commonly, we would see in rheumatoid arthritis swelling in the interphalangeal joints. So it could be the distal, proximal areas of the joints. It can mimic very commonly the Herbiden nodes also. The Herbiden nodes are very commonly in osteoarthritis. Whereas, and that would be very hard and bony, whereas rheumatoid arthritis is more fibrous, thick, and it is a little soft and tough. So that is how you can differentiate a rheumatoid node from a Herbiden node, which is seen in osteoarthritis. So here, since it is autoimmune, so what is autoimmune? Our own cells are going against. So the issue is related to the lymphocytes, the T cells, which is destroying the normal cells, where it leads to changes and inflammation in the synovial layer, where it causes pannus formation. So there will be increase in macrophages and plasma cells. And because this pannus invades further into the articular cartilage, it causes erosions. And very commonly, we would be able to detect autoimmune factors. So we all know about rheumatoid arthritis factor and ACC, that is basically anti-citrullinated protein. So this is something which is very important. Factors which we would see elevated or positive changes seen when it comes into autoimmune categories. So going forward again, what are the common causes of rheumatoid arthritis? So let's try to understand a little about this. So there are many genetic factors involved here. There are so many a times we would see heredity factors or sometimes other autoimmune factors. Now, sometimes patient is suffering from a very simple psoriasis conditions, which is also coming under the categories. So with psoriasis, over time they develop into arthritis, which becomes psoriatic arthritis. And other conditions of autoimmune factors also can call in for conditions where there will be rheumatoid arthritis. Now, why rheumatoid arthritis? Though it is an arthritis condition, joint related problem, but we put it under autoimmune because there is not only the uh, musculoskeletal system which is getting involved, but other systems also get involved. So eyes, skin, and other systems, they get involved in this condition. Now, as I told you, heredity becomes a factor, and many a times we see cases of ankylosing spondylitis. So, in cases of HLA-B27 being positive, in such cases also we will see conditions of rheumatoid arthritis being present. Other environmental factors, smoking, westernized diet, so increased high protein diet so these are all over the time statistically adding up to form the causes of the rheumatoid arthritis. But basically it is idiopathic. There is no specific cause why one person gets into rheumatoid arthritis. Now the age is very important. So it starts from middle age and goes up to the older age group. Females are more affected as compared to males. It is because studies have shown that hormones have played a major factor here. So early menopause or postpartum period have shown higher risk factors in ladies. So this becomes very important trying to understand, and we get majority of the cases we get is females in our clinics. And very commonly in rheumatoid arthritis, we would see changes in their normal in the digits. So there will be turning of the digits, or there can be deformities leading to, I'll explain you the deformities later, the swan neck deformity or Butinet's deformity and all that. But that is again in cases where it is very chronic, many years of this problem of rheumatoid arthritis, and where they would have not taken proper care or they would have not known it is rheumatoid arthritis, many a times neglected treatment, or many a times patients are not very consistent in their role of treatment. Can all this add to this? Obesity is another factor, and stress. Now, stress plays a major factor in these conditions. So, post-traumatic stress disorders or depressive disorders can be a factor for increasing risk in rheumatoid arthritis. What are the common symptoms? Like I already told you, since we are dealing with arthritis, so joint pain, smaller joints, which is getting involved over here. So, symmetric. Now, most important key symptom for rheumatoid arthritis is symmetric polyarthritis. Same joints on both the sides of the body. So, index finger, left side, index finger, right side. Same things show pain, stiffness, inflammation. Majority of the cases. And this is how it is. And then morning stiffness, which would last for more than an hour, improving with physical activity. Now, this is very important symptom in rheumatoid arthritis cases where we would see the patient complains of morning stiffness, and as the day progresses or once they start doing their regular routine activities, the finger joints they release better. So this is something which is very important. And small joint involvement, like I already explained, that's why I stressed about the anatomy to know which joints are getting involved here. So the proximal interphalangeal joints or the metacarpophalangeal joints, or it could be the toes, the wrists. So these are the common joints which get involved first, and then it can lead to the other joints as well. So these joints on touch, because of the inflammation, naturally it would show warmth. It is tender because, and I told you it is not very hard like a Herbeder node. Now Herbeder node in osteoarthritis condition where there will be an osteophyte formation, it is very big, large nodes which would be and very hard. Whereas this, because it is more fibrous, so it is soft, thickening. And then joint deformities are very common in this condition as the disease progresses. Other systemic symptoms which get involved is patient would have fatigue, extreme tiredness, which is reported in almost 80% of the cases. So all these are statistics which we would get in any of our internal medicine books. Rheumatoid nodules, which is nothing but subcutaneous nodules, often on bony prominences. So most commonly on the finger joint we would see, or on the toes, sometimes on the elbows, we can see these nodules present. So we can understand if already these nodules are present, that means the case is already going forward. So the chronicity is more, which is very important for us to understand and treat. Constitutional symptoms. So there would be fever, occasional fever, there will be chills, patient will have weakness, loss of appetite, and other manifestations. Like I told you, it is autoimmune. So sometimes there will be symptoms related to the eye, there will be dryness of eye, and other ILT. So it could be an ILT condition, interstitial lung diseases, or it could be vasculitis, anemia. All these conditions can also come into rheumatoid arthritis, or rheumatoid arthritis can be a risk factor to these conditions as well. Deformity of rheumatoid arthritis. So very important for us to understand here is, very important deformity is swan neck deformity and Boutonniere's deformity. So swan neck deformity is common in majority of the cases. We would see this when cases which would have been suffering with rheumatoid arthritis for a number of years. So there will be hyperextension of the so it will be hyperextension of the proximal interphalangeal joint and flexion. So this proximal interphalangeal joint will have hyperextension and flexion of the distal interphalangeal joint. So this is something which is very, very important, and such cases there would be already damages which would have happened to the joint. Now this is something where we need to understand, and so we can stage that this condition has already gone forward. And deformity of Boutonniere's, so often which is very chronic, and here there will be fixed flexion in the proximal interphalangeal joint and hyperextension of the distal phalangeal joint. So the patient will already have changes which would have happened in their digits. So these are very important deformities of rheumatoid arthritis. Seeing these deformities is enough for you to diagnose. So it becomes very easy for us to diagnose once we understand what are the types of symptoms, signs, and deformities, the pathological changes which happen in rheumatoid arthritis. Investigations. Now, this becomes very important. Why to investigate? So that we understand what is positive, what is negative, what is showing higher value, so that it will help us understand first in diagnosis. As we are doctors of modern medicine, we have to make sure we use the help of investigations, diagnose the disease, because it helps us in prognosis. So keeping this as a factor, any of these titer values, once we start our treatment, after few months, when we test these, it helps us to give us better understanding how the case is going forward, and the case gets corrected. Now, anti-CCP, which is very common in autoimmune conditions, which is very high in cases of aggressive conditions of rheumatoid arthritis. Rheumatoid factor, very specific test for rheumatoid arthritis being positive, negative. Many cases there will be pseudo positive. Nowadays, we are seeing so many conditions. It could be post-viral arthritis, or it could be false positive cases of this rheumatoid arthritis. Many a times rheumatoid arthritis factor is a negative, but the patient would show very similar symptoms of rheumatoid arthritis. So here our science helps. So we treat according to the totality of the patient, totality of the particulars. Depending on what is available for that case, we can treat. So all these conditions, for example, RA factor, the proteins produced by our immune system that can attack the healthy tissue of our body. So this becomes an RA factor, which is to be less than 15. ANA, anti-nuclear antibodies. So this is common in any of the majority of the conditions of autoimmune conditions, where either it is positive or negative. So this helps us to understand in diagnosing rheumatoid arthritis. HLA-B27 is for ankylosing spondylitis. CRP and ESR is related to inflammations. Excuse me. And X-rays of the hand and feet to detect early findings of the joint, which helps us to understand the joint spacing narrowing, or it could be the erosions. So we can make use of X-rays and MRIs. Yeah, so this is about investigations. Now coming to the differential diagnosis, rheumatoid arthritis, we have just explained you how it is. The other differential diagnosis for this condition is osteoarthritis. So this is progressive non-inflammatory. Now, whereas our rheumatoid arthritis, which we are studying for today, is an inflammatory condition. So here in osteoarthritis, basically synovial joint, the same joints get involved, but it's not just the smaller joints. So this is very important. Rheumatoid arthritis is smaller, osteoarthritis is weight bearing. Whereas here there will be cartilage loss and there will be osteophyte formation. Sclerosis of the bone, so body will try to add up extra calcium deposits, so the joint starts becoming larger, and then osteoarthritis, where there will be space between the bones, become less. Osteoporosis is completely different, where there will be reduced bone mass and density, where chance and risk factor for fractures are more. So this is something which is very, very common in osteoporotic conditions. Again, osteoporosis is an geriatric condition, it's an old age problem. Polyarthritis. So here there will be similar to rheumatoid arthritis again, but here in this condition there will be multiple joints involvement. Again, this can be of an acute origin. And as I was just telling you, very commonly nowadays what we are seeing is, especially in Bangalore, is post-viral arthralgia. This again, it's not something very new. I've been treating cases of post-viral arthralgia at least since the last 1 decade. So especially in monsoon season, patients would have a day fever, and post which they will have multiple joint pains. They would have complaints which is very similar to rheumatoid arthritis, which is involvement of the digits and fingers and toes, sometimes even the knee joints, which again mimics chikungunya and dengue also. So many a times doctors, they would recommend them to test for chikungunya. Now there's no chikungunya in India or Bangla. I really don't see any cases that way. It was there probably when I was studying 20 years back, not now. Now we see only post-viral arthralgia or cases related to rheumatoid arthritis origin. So this becomes very important for us to use investigations, treat accordingly, and prescribe. So with our knowledge of Metra Medica and the amount of medicines that we have, we can treat cases accordingly, depending on the type of joint involved and the cause behind. And once we do a better totality, if we get a simillimum, the case gets corrected more faster. Now, commonly allopathic prescriptions which we would see in rheumatoid arthritis condition: Polytrax, Folvite, HCQS, or sometimes very commonly they would use a Vislon, which is a common corticosteroid which they would, corticosteroid they would use, steroidal medications. Now, Folitrax, now very important is basically these drugs belong to the anti-rheumatic drug. So it is an immunosuppressant. Almost, now I've been treating from last 14 years, at least 9 out of the 10 patients who come for rheumatoid arthritis would be taking the same prescription. That is what I would say. So as soon as the patient comes, they say, "Doctor, I've been taking medicine. You want to see the medicine what I'm taking?" I'll tell you, you're taking Folitrax or you're taking Folvite or HCQS maybe. How do you know, doctor? You know because these are the only medicines which is prescribed. So this is where our science is something which is wonderful. So we have so many medicine and any medicine. Now, if we hit the simillimum, even the medicine which would not even show symptoms related to smaller joint involvement will also treat a case. I'll be sharing one of those cases also, which for me was something different. So again, this is something which very commonly they would treat. Now, this again, these medicines have so many side effects. Again, withdrawal symptoms are more. So when I start medicine, so many cases would have, because patients are also are not very, patients who would try to take homeopathy, sometimes they would also, first of all, they would have not been very regular on these medications, or if they've been very regular on these medications, I would slowly taper them down and then gradually wean it out. So accordingly, we treat the condition. And especially, they would always recommend you to do a liver function test to check, and they would always recommend creatine values because it should, these medicines, they cause problems to liver and kidneys, whereas our medicines are always safe and gentle. Going forward, the homeopathic approach. So individualization, constitutional treatment has to be the first choice for us. Always, that is our mission, which is always try to get the best totality, try to work on the best constitutional treatment. But many a times, we don't get it. Patient may not express much, maybe we don't get anything much, or maybe our knowledge is not enough that we could strike the right simillimum, but that doesn't mean we cannot treat. There are many ways in which we can treat homeopathy. You can treat with particulars, you can treat with particulars and physical generals, you can treat with mental generals, physical generals, and particulars. If you get the best simillimum, that's the best thing. Sometimes give one dose and wait, some people give many doses and wait, some give complementary, follow well. We use intercurrent medicines, miasmatic medicines. So there is no hard and fast rule in homeopathy. So there are, every method will always give result. There is nothing that you are practicing right homeopathy, I am practicing wrong homeopathy. No. Homeopathy is homeopathy. Organon of medicine, there is nothing written that, or at all, otherwise there would have not been a book on therapeutic, there would have not been a book on repertory. Why? Because it is all cluster of medicines, group of medicines which help us to give that knowledge of our remedies, which we can use depending on the condition. It's just the time taken when you hit the right simillimum, the time taken is faster, effectiveness is faster as compared to the other way around. Aphorism number 3, knowledge of disease. Aphorism number 5, chronic disease of miasmatic origin. So we need to understand that we are treating rheumatoid arthritis, which belongs to the syphilitic category. So all this becomes important in treating. Totality of symptoms helps to guide the treatment. Peculiar symptoms are the key. So let's try to get whatever best rare and characteristic symptoms. and aphorisms 186 to 203, chronic disease management. All this is given in our organ of medicine. So this is something which is very important. So though we are practicing uh, doctors, always we need to stick to our roots, our our books basically. So we need to constantly keep reading so that only through knowledge we'll be able to excel better. Now, coming to the therapeutics aspect of rheumatoid arthritis, Rustox, Bryonia, Rhododendron, Arnica. So this is a group of therapeutic medicines which have an action on joints, specifically related to smaller joints. I've just given a small group. The group can be much bigger. So all these are commonly used medicines in our daily clinical practice. Now, Rustox, Bryonia, Arnica, Ruta is something which we would use day in, day out in our practice. But when to use, which conditions to use, depending on the case. Like I told you, if you don't get the right similimum, these medicines are your weapons to take care, to make sure the patient gets better, inflammation gets better. These medicines are 100 times better than the medicines which the patients would have been taking, like those painkillers or any other mode of treatment which they would have been on. Because they take those medicines, they feel better, and again the problem arises. That is why people come to us. They say homeopathy is slow. I say homeopathy is not slow because they come to us as a challenge. They would have been diagnosed from 2, 3 years and they come to us and they say, Doctor, make me fine, cure me 1 month. You should be practical. So you need to make the patient understand what you're trying to treat, what I'm trying to do, what is your problem, and treat accordingly. They will feel better. Your first follow up, they will 100% feel better with our prescriptions. Now, these are the commonly used medicines of mine while I'm treating these conditions of rheumatoid arthritis since the last 14, 15 years. I'm practicing in one of the oldest clinics in Bangalore. So my grandfather, grandmother started the clinic way back in 1972. At the same place, I'm still consulting in Bangalore. Along with my father, Dr. RHEUMATOID Srivatsan, we've been treating these cases. So which their rich experience and like I said, my clinic, it's a fast clinic because that I see a lot of cases. So I see nothing less than 50 to 75 cases in a day. So getting so much of time for a particular case becomes a very big challenge for me. Whatever best at that moment or further follow-ups, I try to rectify and try to do the best for the patient. Going forward, let me explain a few of these medicines, what I just showed you in therapeutics. Now, Rustox is commonly we would use in conditions where there would be pain which the patient feels by motion. So, initial movements are painful. Now, like rheumatoid arthritis, where the aggravation is stiffness and pain, all that in the morning, patient feels better with motion. So, you can use these medicines of Rustox. And probably you can use so when probably if you get a similimum or a nearby if you don't get a right similimum or a nearby similimum, you can use these medicines in between to give relief to the patient and try to give similimum in between. Or so this is how it would be. So the patient would have pain while overlifting, overstretching, swelling, stiffness, all these. Now, rhododendron is something which I use very common condition here in Bangalore because weather is cold. So chronic rheumatism, cold aggravation, cold weather. So arthritic nodules present and specifically in rhododendron, smaller joint involvement, wrist pain, finger joint pain, which is very important. So this becomes one of those keen prescriptions which I use. Like I told you, not all cases I'm in a position to get the similimum. I'm being very clear on it. But that doesn't mean that that is not homeopathy. This is also homeopathy. This is homeopathic medicine. So we use rhododendron in cases of uh, rheumatoid arthritis. Give medicines 3 times in a day, probably for a week to 2 weeks, and then we see how the case is. Gets better, then accordingly try to see a better follow-up, follow-well medicine or a complementary medicine depending, and then treat according to the modalities of a case. Causticum. Now, this is a very important, nice medicine. where there is arthritic and rheumatic drawing pain. So the patient feels that pulling sensation, पैर खींचता है, the drawing kind of sensation which they have in their limbs, acute violent pains in the joints and bones. There will be contraction of the tendons, stiffness of the flexor muscles of the limbs. Colophyllum. Now, this is another wonderful medicine. Now, many a times we commonly use colophyllum in cases of conceiving and all that. But colophyllum is a wonderful medicine for smaller joint involvement, where the fingers are very stiff, severe drawing pain in the wrist joints, finger joints, cutting in the joints when closing the hands. So these are very commonly used medicines in my prescription. Actia spicata. Now this is another medicine, though commonly I use this medicine for a carpal tunnel related problem, condition where there would be median nerve compression, where we tingling and pain in the wrist joint. Apart from that, Actia spicata I've used in many conditions of synovitis conditions where the inflammation of the synovial fluid. In such conditions where there would be swelling around, in such conditions or any of the digits around where there's swelling around. So Actia spicata has always helped me in my practice. Ledempal. Now, this is one of those king of arthritis medicines. And there are many a times our most common prescription in a day, at least for any other joint pains. It could be osteoarthritic, osteoporotic, rheumatoid arthritis, polyarthritis, any arthritis, Rustox, Ledempal, Arnica, Ruta. These are those common, most commonly used medicines in our practice. Now, many a times, especially in Ledempal, we know that patient feels better with cold. So use that modality. In many cases, patient feels that burning sensation, pain, swelling. Patient feels better when hand is put under cold water. They keep an ice pack. They feel better. Ledempal. Give Ledempal. The patient gets better. Any of osteoarthritic conditions. It could be knee joint, hip joint, any of these things. Ledempal becomes the choice of medicine. Don't get any much symptom, patient not cooperative, telephone case, not much symptom, WhatsApp case, not many symptoms. Patient bystanders are explaining the case. My father is having knee joint pain. Give medicine. That's all. They will not give an extra symptom. He cannot walk much, finding difficulty to ascend stairs. So you have bryonia, you have Rustox, you have Ledempal. Give them. Patient gets better, then you can ask some more symptoms. But these medicines, they are sure they will help because they have a specific sphere of action. Lycopodium, very specific. It's a trimismatic again. So there's psora, psychotic, and syphilitic condition which works wonderful in this medicine. Arthritic nodositis. You would have pain, there's pain in the wrist joints, nodes on the fingers. So all this will help. So it's everything written in our metromedic. It's just that we need to match it accordingly and treat the case. Stellaria media. This is a wonderful medicine which I use very commonly in treating cases of psoriatic arthritis, psoriasis in general, arthritis, gout, cases where there is high uric acid. Many a times colchicum doesn't help, acid benz doesn't help, sometimes thalapsy but some other tinctures would not help. Few doses of Stellaria media, case comes under control very fast. Very nice results for gout related, or gout would not be there but uric acid levels would be high. Even in such conditions, Stellaria media is wonderful medicines which I have used. Again, smaller joint involvement. Colchicum, very common rheumatoid and arthritic tearing pains which is seen. Guaiacum, wonderful medicine. Again, this is a medicine very suited for arthritic conditions, not only for joint related pains. Now, it could be the pain in the muscular aspects from forearm related pain, thigh pains. Now, patient would have pain in the thighs. So, the patient would have, could be a case of sciatica, but this is not a case of sciatica. I'm not talking about rheumatoid arthritis. In where cases of guaiacum helps is where there will be spasms, cramping, hamstrings, painful. Such conditions I've used guaiacum, and this has produced wonderful results and very easy, fast action I have gotten in my cases. Apart from some more medicines like, of course, arnica, ruta, symphytum. Again, symphytum is a very deep acting medicine which helps to reduce the inflammation very fast. They've helped. And if it is an acute origin, like I was telling about post-viral arthralgia cases or post or viral arthritis, nowadays very commonly we see, Eupatorium perf has helped in many conditions because Eupatorium perf is having bony pains. Now it is commonly used in dengue fevers, where there will be conditions where dengue would show severe joint bony pains. Patient finds difficulty in walking with high fever and all that. So use the same symptoms, match it with your cases. They will sure bring wonderful results. Medorinum. Now, this is a very deep acting miasmatic medicine. So this is again a very commonly used medicine in my practice. Medorinum I use as an intercurrent medicine majority of my cases. So when I'm going to treat my case, sometimes with these acute medicines, or sometimes it could be a constitutional medicine, I use miasmatic medicines or medorinum in specific. In cases, I put them probably once in a week. Cases starts getting better very fast. Recovery is better. And sometime in few cases where the patients have had severe inflammation, stiffness being very adamant, such cases of lower potencies of medorinums, I have used 30 potencies. Sometimes in cases I begin my case with medorinum and then start my acute medicine, and then later on my miasmatic medicine. I've done that. And medorinum has always helped in cases of joint pains. Phytolacca again, syphilitic, deep acting, rheumatic pains, worse in the morning, severe shooting, lancinating, shifting rapidly. Very wonderful medicines. Now, we all use Phytolacca for scrofulous, glandular involvement, but it always helps very nicely in rheumatic conditions as well. Acid bends. Now, again, this is one of those wonderful medicines in our Metra Medica. Most of our joint pains, now specifically clinics, any homeopathic clinic, the patients would always come any other year. Every third case or fourth case is a joint pain case. Knee joint pain is the most commonly treated condition in a clinic. So acid bends help. Now acid bends again, uric acid diathesis, nodes, upper and lower extremities, crackling of joints, uh, the ligaments, muscular aspects, up and below the knee joint, all these conditions, acid bends help. So I've used this medicine very commonly in my clinical practice. Calcarea carb. Now, calcarea carb is another medicine which I've used commonly in rheumatoid arthritis conditions. Again, like I said, this is also very triasthmatic. So psychosis and syphilitic symptoms are seen in calcarea carb. So patient obese, they have some characteristics of calcarea carb. I use this. And very commonly in osteoarthritic conditions of knee joints, or it could be rheumatoid arthritis going with knee joints as well. Age. Now, it could be an elderly person with rheumatoid arthritis. You cannot say, I have only finger joint pains. She cannot or he cannot get knee joint. It is not that the patient will have only rheumatoid arthritis. People can have rheumatoid arthritis, osteoarthritis, osteoporosis also. They can have cold cough also, fever also, other symptoms also. So when you're treating a condition, sometimes we can use these medicines of help to treat. So calcarea carb, very wonderful prescription, not only for smaller joints, even for knee joints, especially ladies, it helps. Many medicines, I've just highlighted a few. Like I said, our Metra Medica is such a vast thing. We have so many medicines as compared to the other systems where they have just handful of prescriptions. We can do a better justice to the patient. So remedy selection is based on totality of symptoms, constitutional type, asthmatic background, mental and emotional state. This is something which is very important for us in treating cases. Now here is I've just highlighted two cases where I have got the uh, similimum. So here is the patient. She's a 52-year-old and she's married and a senior bank manager. So she comes with pain, stiffness, in the finger joints, swelling in the ankle, pain in the left knee. She has attained her menopause about 4 years back, and she's moderately built, not too obese. Physical generals, nothing very marked. Bowels, urination, all good. Thermals hot. Thirstless. Now, thirstless is so difficult in Bangalore. Bangalore is having such a weather where we don't really drink much water. So it's very difficult for us to assess the condition in Bangalore. So thermals and thirstlessness is something which is very, very, everyone feels cold, everyone feels thirstless in Bangalore. So just that we need to try to ask them, because many a time becomes habitual. Just try to get whatever best is possible. But here in these cases, like I said, in these cases, sometimes the case opens up nicely, patient is very cooperative. I get, with my best knowledge, a medicine, it helps. The patient here was very anxious. She was very apprehensive towards her health. Her father also had joints related discomfort, pain. Now, whether they knew it was rheumatoid arthritis or not, they don't know. He'd also suffered from arthritis, is what they know. They don't have that information. So even he had finger joint pains, knee joint pains, all geriatric related complaints he had. So she was very apprehensive with her health, weeping very easily. She was very fixed. Now, very important in this condition is the patient is very routine. She had her fixed routine and she didn't like changes in it. Even in her bank, her scheduling. Now, she's a senior manager, and even at home, she wanted things to be particular. She's very organized, fastidious, and all that, but does not like those changes. So this is something which is very fantastic with the Carly group. So irascibility is something which was very marked. She gets irritated very easily, short-tempered. I would say any bank person is short-tempered. So when you go to any bank, you go to and approach a bank employee. First thing you go and ask them, "Huh, what do you want?" So it's that the immediate first reaction for any bank person is anger, irritably short-tempered. So I would not say anything like that. So everyone gets anger. So it's something which is nice. People say, "मुझे बहुत गुस्सा आता है." So it's something which is nice. So people feel nice about it. So anyone, you would say, I get angry very easily. So again, that is not very marked. So one thing which was marked over here is she is good with her employees. So this was when her daughter interrupted in between. So her daughter interrupted the case taking in between, and she said, with basically with her friend, she's very fine, doctor, but with me, she's always angry. Now I started thinking, is it because of menopause she's had? Maybe hormonal, ladies, you can never say. It would have been a passing phase, could have been a factor that she would have been showing anger towards her daughter. Now, easily, it's the immediate family which we would show our emotions to: husband, parents, or children. And something which is very marked over here is she's always been angry with me most of the time. She gets angry, irritated all the time. Even the patient, in fact, said, "Yeah, doctor, I get angry very easily with these people, and I always feel very impatient when I'm in the house." This is something which is very important. Most of the Kali groups, it could be Kali Carb, Kali Phos, Kali Iode, any of the Kali groups, anger towards family, and they balance. So these are those workaholic people, fastidious, organized people, planners. I would put Kali group as. Kali groups are planners. They are fantastic when you start studying about Kali group. So I had a lot of knowledge. So maybe I picked up these few things and then selected Kali iode as a prescription over here. So the rheumatoid arthritis factor in this case, she had a 42 value titer, and then CRP was 6. And then as the case progressed, the patient started feeling better. Stiffness was persisting. Pain was better by 20%. Irritability was a little better. And as the case progressed, she still had a lot of swelling in the ankle. Even with a slight travel, a small car journey, also she started saying that she had swelling. And she still complained of stiffness. So this is where I started introducing miasmatic medicine. So I introduced sulfur. Now, why sulfur? Because I have that thing sometimes where I first start with an anti-psoric, then it could be an anti-syphilitic, then again anti-psoric. Or if it is a psychotic condition, then I use psoric, psychotic, psoric, something like that. So this is something which I've learned in through my understanding of organ, and that's how I use in my prescriptions. So sulfur was introduced just a single dose for 4 Sundays, post which the patient started feeling better. And then, like I said, I used Medorinum 200, where she had that stiffness in her digits. She started feeling further better. And after a couple of months, the RA factor was about 16.5. Readings have come into a category where it's come to normalcy. CRP is fine. Case is okay. So this is the value. We came with 42, and then rheumatoid factor was 16, CRP 0.8. So this is all fine. Now coming to the second case of rheumatoid arthritis. So this patient has, this is again a wonderful case. Now here, why this is something very interesting in this case is, I never thought I'll prescribe this particular medicine in this case. The patient is young, 30-year-old, developed rheumatoid arthritis. Now, pain, stiffness, and she had a rash near her ankle and feet. Small reddish dots, uh, rashes which was seen. Now, very important in this case is the patient. Now, this, in fact, patient, I've been treating her son, who is about 3-year-old. So she initially came for her child, and then she started coming and getting herself treated for arthritis. So I've interacted her earlier also before I started drawing her case. So she used to come to the clinic very nice, very attractive. Very important how a person comes into the clinic. That is very important observation which you have to make a note. And while taking the case, she always kept on saying, "Doctor, I want to look good, doctor. Because of arthritis, I don't want any of my joints to become crooked. I don't want this rash to come all over my body." Her physical appearance was very important. That is something which is very important. Post likes to be complicated. Now, this is something very important. She was with her husband and her 3-year-old son. She kept on saying and nagging her husband, "Doctor, see, I am very scared that this should not happen and I should not get into a big problem. I know rheumatoid arthritis, autoimmune." So she's well versed. She's very intellectual. They know their condition. But though I try my best to look the best, but my husband doesn't say anything to me. He doesn't compliment me only, "Doctor," is the first thing which she would say. So she feels ignored. And one thing, these patients, this particular person, so I have known this person, as I told you, because I've been treating her child. So she comes sometimes, they come with their friends. So when I see them, when I have my CCTV, I see them in the waiting hall. So how their gestures, body language, they're very vivacious. So she's very, they're trying to project themselves in a very nice way. So flattery is something which is very important. For that particular reason, under the repertory, I selected palladium. So she started getting better with this medicine. So Palladium was selected for that reason. She felt good. I mean, she's a person who feels good with compliments. She's a person who would always feel nice when her husband speaks nice. She was always snappish in front of me. To her husband, she was very snappish. "Ah, you don't take care of me. You don't do this. See, doctor, look at him. He says I have so much of pains, but still he expects me to do so many things. I just want him to say that it's okay. Take care of me. Don't worry. I am there." She likes those things. So that is what is important. So keeping that as factors and all these, her physical nature, her how she wants to present herself, all these things, her appearance was very important for her. Palladium, as I prescribed further, swelling started getting better, but the rash in the ankle persisted. RF factor was again done. It came down to a level 51. Further, palladium was reintroduced, and I introduced syphilinum as a anti-asthmatic medicine, and then further in August, I have introduced sulfur and palladium again for the repetition of course. The rash is better. It's almost clearing well. So now this was the case. So she came with these conditions. So this was the rash, little near the ankle. You can see a little darkish, and then there were small dots. Now the dots are very small, faint, and very little. So this is how her condition was. So she was very particular about her values, her stiffness, her swelling, everything was much better. Coming to the conclusion over here, homeopathy offers a very holistic aspect in rheumatoid arthritis management via symptom totality. Goal is to improve quality of life, reduce complication, and treat the patient and not just the disease. This is what our master says, Dr. Hahnemann, and this is what I have tried to inculcate in my practice, which I have learned through my books, my teachers, my father. Over the years of experience, I have learned this, and I've been working on rheumatoid arthritis. Like I said, not all cases of rheumatoid arthritis you can get values coming under control very fast. There are cases which would have gone into prognosis of swan neck deformity. We can't do anything much about it because the fibrosis would have already happened. The best thing you can do is try to make sure that disease doesn't progress much. We can still try to make sure the case gets better. Try to see how much we can try to help the patient. Give medicines. Don't get scared. This is what I say when I was teaching in college here in Bangalore. I used to work in the department of surgery earlier. I've given a break in teaching the last couple of years, but I was into teaching for about 6 years initially. I used to tell my students, don't fear. Very important that you have to first prescribe. Don't worry. Give medicine, let the patient come, see the follow up, then you change your medicine if needed. Because, like I said, getting a simlimum is difficult. It's an art. Homeopathy is an art and science. It's tough. But it's again not very difficult. Match the totality what you have in hand, prescribe. As I explained to you, there are so many, I just explained so many medicines in our Metra Medica. Not only these, there are many other medicines in our Metra Medica, lithium carb, graphitis, which have very deep actions. We can use these medicines as our source and then treat the patient accordingly. Give short follow up so you can know whether the medicine is acting. They will feel better. They will come back to you. Once they come, always remember the first follow up is very important. After you prescribe, the first follow up is most important to make sure the patient gets better. Because today, with the amount of doctors around you, or the patient's level today in patients is very less. So always try to give some amount of relief, and then you try to work out better and better. This is something which is very important. I would like to thank for a very patient hearing by all the viewers. And I would like to thank Dr. Sani sir, Dr. Danish sir, and Dr. Ajini ma'am. Thank you so much for giving me another opportunity in IFPH platform for sharing my clinical experience or my outlook on rheumatoid arthritis management and treatment.
Thank you so
Thank you so
much,
much.
Dr. Rohit Srivatsan. Actually, like always, today's class also very excellent and informative. Thank you so much. You're studying the cases very deeply and prescribing the medicine. Wonderful it is. The participants, if you have any question, means you can ask to Dr. Rohit. We have 7 more minutes. I think Dr. Ram Parvesha sir is ready. If anyone else have question, means you
Thank
can
you.
raise.
Thank you, Dr. Anjani. Congratulations, Dr. Rohit Srivatsan.
Thank
Very
you, sir.
very nice presentation.
Thank
and
you so much.
deeply describe the rheumatoid arthritis and lot of medicine. Describe the lot of medicine. Rheumatoid arthritis case presentation, second case presentation, palladium is the very good, and intercurrent miasmatic remedy, syphilna.
Yes, sir.
Good select. Angle of treatment, chronic cases, angle of treatment. First subject, symptological angle. Very good, easily angle, symptological angle. And second, mathematical angle. Just like palladium and syphilis. So, mathematical angle and pathological angle.
Yes, sir.
Pathological angle is a very difficult angle.
Yes.
Mathematical angle, curative way of angle. Without mathematic remedy, not cure the chronic case, chronic disease.
Yes, sir. Because
ऐसे
for
हमारे
the
पास
recovery, it's
हाँ
always important we introduce the miasmatic medicine.
हाँ
Otherwise, the
ए-
patient feels better, then the case will
हाँ
slowly going out of hand. Miasmatic will try
हम्म,
to bring it back again, sir. It'll open the case
हाँ
better.
हाँ Dr. Handman treat the patient, not the disease.
Yes.
So, homeopathic gently and rapidly and permanently cure. So, according to miasmatic treatment, is the permanently cure. Thank you, Gargar Homeopathy, Gargar Homeopathy.
Thank you, Dr.
Thank you.
Ramparveshwar, sir. And I'm inviting Dr. Danesh. Dr. Danesh, you can talk.
Yes, thank you, Dr. Rajini. Yes, Dr. Rohit. It's once again you rock the floor with your knowledge and your both cases were excellent. As we know that rheumatoid arthritis and rheumatic complaints are quite common nowadays. And but as people used to say that these are due to this.
Yes, sir.
People used to say that there is no etiology behind all these things, but still, we have reasons behind these diseases. As you rightly point out, we need to study the case in detail, and once you choose the right remedy, you will be able to choose, cure the case. But sometimes what we find is that there are certain obstacles in the way of cure. Because people used to take a lot of analgesic before the treatment, and only after some time we may get the real
Picture of the condition.
patient inside.
Yes,
What's
sir.
your opinion on that, and how will you go ahead in that conditions?
That's what, sir. Like in many cases, where the patient would have already been on long-term medications, as I told you, they would have been on strong allopathic drugs, or it could be steroidal medications. So I would initially start with our medicines, our simple acute medicines initially, and slowly taper them down. So that is something which is very important. When the patient they come to us so that they want to slowly come out of medication, because there's no point. I tell them there's no point you taking that medicine and this medicine same. What is the fun? Why you want to pay me fees and take that medicine, pay that also? Somewhere we have to gradually bring them down. So gradually when I taper it down, again, the withdrawal symptoms should not happen, or the patient should not start feeling extra pain. So basically the pain gets better, the patient starts getting that confidence, and then we can slowly start taking more symptoms out. Maybe we can get the mental picture better. We can better prescribe a better constitutional medicine for that case. And miasmatic medicines, I think there's a question related to that, uh, which time of treatment we should prescribe anti-miasmatic. Like I said, in many of my cases, so not only in rheumatoid arthritis, in any chronic disease conditions or any case in clinic, where I give my present totality, I give a medicine, patient gets better, then again the patient falls ill, we give another set of medicines, they get better. But this repeated problem, or the patient feels better but again starts getting the symptoms back, and that is when we have to use miasmatic medicines. Again, there is no hard and fast rule in Metromedica when we have to give. It is again the doctor's choice. It is doctor's experience, doctor's confidence, and how much the doctor does not fear. That is very important.
Yes,
You should not fear to give medicine. So
yes,
you have to give the medicine. If you feel that you're confident enough that you can prescribe these medicines repeatedly, frequently, go ahead. Nothing will happen. Our
yes,
medicines are a lot safer than the medicines which they are taking already.
yes. We need to educate the patient in such a way
Yeah.
that what.
Doctor, we have
So we can always use these miasmatic medicines.
Yes, yes. That's good. That's
Dr.
good.
Sheila has raised hand.
Yes.
Dr. Sheila, you can ask your question only 1 minute.
Yes, sir. Very good evening, sir, and thank you for the information. One more thing, sir. Can you repeat when we can give this first antisoric, then Andy? Can you please repeat that one, please?
So basically, that is basically in cases where it is one-sided conditions, or it could be when we're treating any chronic related conditions, or any, as for such conditions in our aphorisms, it has been mentioned whenever we don't get the right totality, or when the totality is not giving the correct result or up to the mark. So that is when we can introduce first soric, then we go to, depending on it is psychotic or syphilitic, then again go back to soric. So by doing this, the case, you get the better presentation of the case, more symptoms, so that you can match the totality better. So this is how Dr. Hahnemann has mentioned in our aphorisms.
Okay, sir. Okay. Thank you so much, sir.
Thank you, doctor. Thank you for your wonderful session. And now it is the time to end up the English session. Thank you so much, all the participants, for joining with us. Now we are moving to the Malayalam session. Good night, everyone. See you tomorrow the same time. And I'm inviting Dr. Anjita for moderating Malayalam session. You're welcome, please.
Bah.
Thank you. Thank you, Ajina doctor. And thank you for hosting the